All right.
Oh,
So,
I don't use this.
okay. Well, I don't know how to do it. I don't think we could. I
Okay,
think.
go ahead.
Hey guys, so we
Okay.
have some technical difficulties.
So, here we are. You're getting some bashing about being late, like a typical doctor.
Well,
Some morning negativity.
this is why we call you a patient,
You.
and we have a waiting room. Unfortunately, yeah, I'm going to get to the bottom of this. It's very frustrating, but we appreciate your patience and also the tolerance for the nice lighting that we have. But we do have about 700 people that are on, so we're going to take your questions. And for those callers, guess
Is
what?
that YouTube
This is YouTube.
or Facebook?
This is YouTube. And for you callers, I'm going to also answer your questions that I have. So I'll tell you what, Karen, we're going to start with Maria. She's from Green Bay, Wisconsin.
Okay.
And she wanted to know the best treatment for my 17-year-old grandson's lupus. Okay? So,
Yeah.
so let's see if we
Let's
can't
see
do
if
this right
this
here. Oh yeah, this is great. Okay,
I
good.
can push this down.
Oh, nice. All right, good. So we're
that better?
in business here.
Okay.
Yeah. Okay, great.
Just like it never happened.
So, good. We have about 971 people on. So everyone just switch over to the YouTube.
YouTube. We
The
could have
YouTube.
the YouTube.
Yeah.
I could go on to Facebook and tell people that.
Yeah, do that. And I'm going to talk about, this is Maria, this is towards Maria, Green Bay, Wisconsin. Again, you guys can still call in. We can answer your calls. I just won't be able to talk to you. So the best treatment for lupus, hands down, and by the way, anything that we say is not meant to diagnose you or
It's no
treat
treatment.
any of your medical diseases or even cure you. Just meant for you to do your own research with help of your doctor. But here's the thing. Vitamin D is what's called an immune modulator. So it helps to control the immune system, and higher levels of vitamin D. And you can start out with 30,000 IUs of vitamin D. I put a video out under MS, and I would apply that same protocol. It's by a doctor in South America, Brazil, I think. And great protocol, great results with autoimmune stuff. So you can check him out. I put a link down there. So just look up MS because it's really good for all the autoimmune conditions. One thing about autoimmune is that the immune system is creating this inflammatory situation. So you have a lot of collateral damage. So this damage is destroying everything. So if you could literally get rid of the inflammation part of it, all of a sudden you put everything back in remission. So higher amounts of vitamin D is going to be the thing to do. And in addition to that, intermittent fasting. Those two, hands down, are going to be very helpful. Okay? All right. And then Angela had a question from North Carolina. What are my thoughts on ozone and stem cell treatment?
Interesting you say that.
Yes. I'm very interested in this. In fact, I'm doing a video on today. You read my mind. I love the ozone therapy. It's fantastic. Ozone is a gas, and it's an added oxygen molecule, so it's O3. There is a danger of inhaling it, so you're not going to breathe it in. There's other ways that you can inject it, of course, with someone that's trained, and also you can have it infused with olive oil and put it on the skin. It's an antibacterial, antifungus, antiviral, but it also permeates oxygen into the body to help heal the skin and the inside of the body and the tissues. I suggest you just wait for the video that I do on this later in a couple days. As far as stem cell, that's another really good therapy. I have a video on that. There's also some new things on a version of stem cell, which is peptide therapy, but stem cell is great for inflammation, anti-aging, and you're basically using a cell that is undifferentiated. So you're basically, and it'll turn into whatever cell that is needed, wanted. So I think the future of stem cells is going to be huge. It's one of the natural, has very minimal side effects, so I highly recommend it. Thanks, Angela. And Kelly's from Wisconsin. Kelly is from Wisconsin, and I think you can hear me, right, Kelly? I know you can, so I'm just going to put you on pause and
I
answer the
hear
question.
something happening on the other side.
I just put her on pause.
Oh.
So Kelly had a question, is saw palmetto good for PCOS, polycystic ovarian syndrome? And the answer is, saw palmetto is good for handling a very powerful form of testosterone and androgen. So it is good, but there's something much better, and that is lowering your insulin level. So this is why the most important thing is to do keto and intermittent fasting to drop the insulin, which is then converting to androgens, because PCOS is an androgen problem in females, and you don't want excessive amounts of androgen because of the facial hair and the acne and the weight gain. So that's what I would recommend. Thanks, Kelly. And also, all the questions are going to be coming up here if you want to try to capture a few, or there. We'll try to get as many as we can. But you know what, Karen? I think it's time for a question for people, a quiz. What do you say?
Go for it.
Okay, good. So the question is, what is the biggest benefit of exercise? And the answer is not weight loss. What is the top, actually, I'll tell you what's the top 2 benefits of exercise that goes beyond just weight loss? Because exercise is a very minor benefit, but there's 2 even more important benefits from exercise. See if you guys can guess this question, okay? Guess the answer to the question.
Now, are you on Facebook or YouTube?
I'm on YouTube. And you are on, I'm not sure where you are.
I'm on YouTube.
Are you on the same? Yeah, you're on the channel that I don't even think it's working, but are they able to hear anything? See anything? If not,
No.
tell them.
Nothing.
Tell them to do this. If you go just to my channel, Dr. Berg, you'll see this live video, and you can actually just log right on and listen to it.
drberg.com.
No, YouTube, and then they go to my channel, and then they'll see a live video, and they can go to that one instead. Okay? So while Karen's working on that, this is called a cope, guys, a cope.
Happens in life. Probably every day.
Yes.
There's something you have to cope, doesn't go exactly the way you want it to, and you just roll with
It's
it.
called punting. Okay. All right, someone had a question here. Oh, strength and improved cardio. Good answer.
What was the question?
What are the 2 benefits of exercise that are not related to losing weight?
Oh, I see.
All right, brain health, increase oxygen. Okay, good. All right, let's see what else. Mental health, cardio health, energy, growth hormone increase. Good answers, guys. Heart and vascular, heart health and brain health. Reducing stress. Okay, you guys are on track. You're doing really good as far as with your answers, but let me give you the correct answers. Okay, the two answers to this question with exercise is you build up your antioxidant reserve. Okay, so you get more antioxidants internally. Your body just makes more. That's a huge benefit. That will decrease free radical damage. But secondly, exercise preserves your muscle mass, so you don't lose muscle. And I'm talking about regular exercise. How many of you found that with aging, your muscles are not cooperating like they should, and they may even kind of start sagging off your body? Raise your hand. Anyone? I guess you can't raise your hand. Exercise is the absolute best way to stimulate the system. It creates a mild stress that then causes your body to rebound and preserve muscle mass without the loss of mass. So if you're sedentary and you're waiting someday for a reason to exercise, these are the 2 very important ones. Preserve your muscles, and you have to work harder because every single year you're losing at least 1% of your muscle mass with aging. So if you're 80 years old, this is after 50, by the way. So if you're, it's just like 80 years old, 30% of your muscle is gone. So you want to do things to prevent that and preserve muscle mass. Regular exercise, and what's the second thing?
I'm busy reading.
Okay.
Sorry.
Okay. Antioxidant reserve. Okay? Yeah.
Okay, good.
Okay, good. So Karen, let's go to Mayri. We're gonna answer Mayren from Tampa.
Mayreen.
Marine.
Mayreen. Hey,
So-
we can hear you.
Yeah, I can, but no one else can.
Oh, no one else can.
So I'm gonna put her on pause because
Okay.
Can we take psyllium seed, that's a fiber, and bone broth during a fast? Now, it's interesting because I just released a video on this yesterday, I think, or the day before, on what you should eat and should not eat during a fast. The fiber is totally fine because it absolutely will not increase insulin, but the bone broth is protein, and that's the one I would not consume bone broth on a fast because it's protein. And we want to avoid protein and carbs. So watch that video because I give everyone a detailed answer because I talk about the difference between breaking a fast, breaking your ketosis, and losing weight. 3 different separate deals. Okay? All right, Karen. Do you have any questions?
Yes, there was a question from a couple of different people about when to eat your meal. That you stress eating lunch and dinner,
Yeah.
or just one in the afternoon, but what if they wanted to do breakfast? Or is there any advantage, or is it better to do a meal at one time than another? One of the people said that their doctor was really promoting doing the keto diet and intermittent fasting, but really pushed having their meal as the breakfast meal.
I think that's an excellent question, Karen. That's a fabulous question. All right, let's go to Joseph. No, I'm just kidding. This is the answer. Here you are. It's 6 o'clock at night. And then, of course, you're not going to eat after your dinner, right? And then you're going to sleep all night long. So you got this jump start on fasting. Okay, so you're fasting and you're sleeping, and then you wake up. If you break that fast, you just kind of ruin the longer fast. So eating a breakfast is not the best meal.
That was another question.
I know, I'm getting to the answer.
Okay.
So you want to ride the wave in as long as you can until your first meal. Now, that being said, you could, based on your schedule or interest, eat your breakfast and then maybe your second meal at 3 and then not eat after that if you want. Really depends on your schedule, and also some people, for example, really have to have a snack at night. So I recommend they go as late as possible, maybe even have the last meal like at 9, and so they can eat late at night and then they fast all the way until the next day. Did that answer the question?
Can you just have breakfast as your meal if you're doing a OMAD?
Yeah.
Good.
Well, that was simple.
That.
Good. Do you have any other questions?
Yes. Kathy asked, if you're doing an 18-hour fast, does it actually give you a repair benefit, or do you have to go longer?
No, 18 hours is a good amount of fasting that will give you really good benefits. I would do at minimally 16, but 18 is better, and 20 is even better. But I like 18. You'll get a lot of benefits.
Okay.
All right, can you read that, Karen?
Yeah, I can read it.
What does it say?
Is it safe to consume carb powder or cream, carob powder or cream during your fasting?
Yeah, I wouldn't do carob powder because I do know that it has carbohydrates. Now, it's funny you're asking these questions I just did a video on, guys, but the cream, it's fat. It won't break your ketosis, but it's going to slow down your weight loss because your body's going to burn that as fat instead of your own fat.
Ketosis during pregnancy?
Yeah.
Of course, yes.
Oh,
definitely.
absolutely. Just don't do the intermittent fasting. What about that one? Gastroparesis. I did a video on this as well.
What is that?
Gastroparesis is a situation where your digestive system is really sluggish and slow. And what you need to do very simply is consume hydrochloric acid in the form of betaine hydrochloride as well as apple cider vinegar. And I'm telling you, that's going to help you tremendously. Absolutely. Okay? All right, good.
You want another one?
Let's tell you what, let's go to Joseph and then give me another one.
Okay.
Hey Joseph, you're from Hudson, Florida. Your wife hit a plateau on OMAD. What do you do? Good question. Then of course I did another video on this
It's 100
yesterday,
videos, right.
which basically what I want to know, and maybe I could just ask Joseph this really quick. Joseph, you can hear me. Can you tell me if
He's
is
there.
your wife losing inches in her midsection or not? Okay.
Wow, 190 pounds. That's amazing.
Okay. Wow.
Wow,
Well, let
even
me-
the rooster loved that one.
Well, let me just answer the question because the problem is no one else can hear you except us. So
Yeah.
I don't want to. I have the gist of what you're asking. Here
Every
you are.
time he says something good, I don't have to ring the bell because there's a rooster in the background.
There's a rooster in the background,
And he's cheering you on, Joseph.
and they lost a lot of weight.
190 pounds.
Yeah, and now they're kind of getting to this point where now it's stopped, right? And so we're not seeing inches lost. If you saw inches lost, then that means it is working, okay? But if you don't see inches lost, and you have that last 25 pounds or whatever to lose, all you have to do is do OMAD, 1 meal a day, every other day, okay? You just have to go strict with the intermittent fasting, go longer, get down, lose that extra weight. This happened with another lady that I showed you that before and after picture. I interviewed her yesterday. Incredible. She was over 300 pounds. She's down to 138 right now.
It's incredible.
I know. 2 years. And what she had no problem. She just went bam, bam, bam. But the last 20 pounds wasn't coming off. So she cut down the number of meals. And so she went long with fasting, dropped that last 20 pounds. Now she hit her goal, 138. Great interview. But that's what I would do, Joseph. Good question, though. All right, let's go to another.
Well, here's a question. Any vegetarian options for fish oil replacement?
Yeah, because you need your DHA, and there's some algae. That's a vegan-friendly algae that gives you the DHA. And you know what else you could do for B12, which is a different topic. My wheatgrass juice powder, which I'm not biased, or our wheatgrass juice powder, which we're not biased, has B12 in it, double the RDAs, which is interesting. It's actually from a microbe. So that's another thing you want to do. I do want to, and I'm not biased in my own, our own keto essential aminos, but I do want to plug this product. A lot of you guys are taking already the essential aminos. What's cool about this is that it turns into body tissue at 99%. In other words, there's only 1% waste as compared to like a steak. You're wasting about 68% of that either as fuel or through your urine. So if you are struggling with getting enough protein, and I do want to talk about that shortly because it's a very important topic, this might be a nice little enhancement that you might want to do because you don't waste any of the protein. Karen,
Yeah.
a steak, okay, I'm just going to give you an example. If you have a steak that's like 100 grams, that's 3 ounces, 3 or 4 ounces, take a wild guess how much of that actual steak is actual protein. 100 grams. How many grams would be actual protein?
I would think that most of it's fiber, so maybe 7%?
Good answer. It's actually 25%.
Oh.
So 25, but still, like 25 grams out of 100 is actual protein. The rest is water and other things. I mean, that's like crazy. You think you're getting a lot of protein when you're eating a steak or even fish. You're not getting as much as you think. Now, if we take it one step further, and I will be doing a video on this, if we take a steak and ask how much of that actual protein that you're getting from the steak is actually turned into body tissue, now we're dealing with a very small number. We're dealing with like 30%. So you're getting 30% of, I don't know, 25 grams is 8, roughly
Times
8.
2, carry the 7.6.
8 grams. So when you eat a 3 ounce steak, you're getting actual only 8 grams. I mean, people actually need a little more protein than they think. So the problem is if you have a steak, you're getting waste in fuel. So this is one advantage with those aminos. I personally noticed a nice change. You started taking them, but I really like them as an enhancement because you only waste like 1 gram or 1%. Anyway, watch the video on that. It's coming up very soon. All right, you have another question?
I have lots of questions. Okay,
Yeah.
question regarding coffee, refined or unrefined coconut oil?
Unrefined.
Always go unrefined.
Yeah.
Okay, so here's an interesting question. Why do you recommend 1 cup of coffee a day when, and there was a paragraph. So I think the confusion is that there isn't a recommendation to have 1 cup of coffee a day, just happens to be.
I always tell people 1, just because it's
Meaning, if you're gonna have coffee, limit it
right. Not
to
that,
1.
Not.
The point isn't start drinking
Right.
coffee,
Right.
right?
That's right, because the caffeine can keep you up, and you know what? It's going to interfere with your sleep. So, yeah.
Yeah, the point is not start drinking coffee.
Right.
Right, okay, good. So question, if you had chronic hepatitis B, would the ketogenic diet benefit you in any way, and how?
Well, I think only from the fact that it's going to reduce inflammation, and the fact that if you add intermittent fasting in there, it's icing on the cake. Both of those together will drop inflammation because ketones will be very anti-inflammatory. So it's going to help anything with itis, hepatitis, arthritis, bursitis. So yes, I would highly recommend that. As far as virus goes, you want zinc to help put that virus back in remission and put
But
that.
it's not treatment?
Of course, we're not treating any diseases, but it may help you. Yes.
Good. Now, there's a general question about epilepsy. How is it that the ketogenic diet helps epilepsy? What is it?
Yeah, epilepsy is definitely a dysfunctional part of your brain. And so if you take ketones as your fuel instead of glucose, it bypasses the damaged part of that brain and can feed it what it needs, and the epilepsy goes away because you're using a different fuel source that the body can use as compared to the glucose, which your body can't use. All right, good.
Fair enough.
Let's see here. It says coffee increases your fat burning capabilities, so it's good for keto. I mean, maybe a little bit, but it's not necessarily the thing that's going to help you burn fat. What's high in essential amino acids, and is it a good balance for an easy metabolic without processing excess amino acids? Well, the only thing I wanted to say about this little product right here is that there's a ton of research in the combination of how that's put together. And if you go to my website, I have the links there. There's massive double-blinded studies that show that out of all the combinations of amino acids, this was developed to get the maximum conversion into your body tissue. So if you just buy a regular amino acid product from the store, you're not going to get the same effect. So it's really the research and the science behind this product. I really wasn't, honestly, I wasn't interested in even having that as one of my products until this doctor who was enlightened me on it. He kept following me around and he kept saying, finally it got my attention. He started telling me more about this, and it just like a light bulb went off. I said, wow, I have to learn more about this. Okay, send me some. I started taking it. I was like, wow, my muscles I feel just more, the muscles are more dense, stronger. I really like this product for endurance. So I'm like, okay, I got to carry this because this is awesome. It's an awesome product. So I have some personal reality on that. While you're looking for those questions, Karen, I want to go to Valerie. She's from Denver, Colorado, and she had a question regarding, she started keto, but she's having constant migraines. So one thing I want you to, hey Valerie, are you there? Okay, really quickly, just tell me, are you taking MCT oil or exogenous ketones? Hey, Valerie, unfortunately, I would love to listen a little bit more, but I can't because everyone's watching, so I'm going to have to just quickly summarize.
Yeah, they can't hear you.
They can't hear you, so I'm really sorry about that. But here's the thing you should do, Valerie. You just ordered the MCT oil. Start taking that. That will at least get your brain in, because I think you're not transitioning fast enough. So take the MCT oil or exogenous ketones. It'll go right to the brain. Your brain will be happy. The headaches should go away. If it does not, then you need B vitamins, specifically the nutritional yeast, and that should handle the migraines. That will work 99.99% of the time. If it doesn't, call me back next week and we'll have everything straightened out. Thanks, Valerie. All right. All right. You look for that. Let me just go to Kelly from Wisconsin. What part of Wisconsin, Kelly? Oh, okay. So I think I might have answered this already, but saw palmetto can be helpful for PCOS because it actually decreases the, it's like, it has an enzyme in there that help to reduce the stronger type of androgen. But what's going to work better, Kelly, is you doing the keto and IF, because that's going to reduce your insulin, and then that's going to reduce your androgens, okay? So, and then your PCOS will be improved.
The thing you have to remember is you have to actually not just answer the question, you have to ask the question, because these guys aren't hearing the question. So on Valerie with her
Okay.
headaches, she was just saying she's on keto, but she has migraines. Now, we don't know, did she have migraines before that
Yeah.
or not? But her point was just she is trying keto, she's working her way to get into keto, but she's got migraines. So that question was an answer
Good
about
point.
migraines.
Good point, Karen.
Yeah.
I already answered Maria's question. She wanted to know, my 17-year-old grandson with lupus, what should I do? And the answer is vitamin D, vitamin D, vitamin D, high levels of it. Go to my video on MS and watch the protocol that I give, because that's good for all autoimmune conditions. Again, check with your doctor first, but I give you a link on a doctor in Brazil who's getting fantastic results with that. It's vitamin D. Good question. All right, you find a good question, Karen.
Yes, sir.
And I'm gonna go to Gabriel from Indianapolis. Had a question, do carbs and spices count? It's all relative to how much spice. It's gonna be really, really hard to have any significant amount of calories in spices. So I would, it's such a small issue that I would not worry about it. I would put lots of spices in your food, garlic, whatever, not a problem. Cinnamon, because the benefit of spices are really good for your food. Except the only spice I would not recommend is any spices with MSG. And Jennifer from Lancaster, Pennsylvania, had a question. Is keto safe for someone who has MS? Well, I think it's very, very essential to do it because it's going to reduce your inflammation. I mean, think about it. If you had MS and autoimmune, would you want to add more carbohydrates? That's going to add more inflammation. So you want to do intermittent fasting and healthy keto for any type of autoimmune condition, just to drop the inflammation. Good question, Jennifer. All right, Karen, what do we got?
Okay, so would you ever recommend adding carbs for an athlete?
Yeah, I think I would, but I would probably try to stay within your 50 grams. So just go higher, because you may need a bit more energy unless you're fully adapted, and you also might lose too much weight if you. So I would keep it right about 50. Now, some people, let's say you're younger and you do a huge marathon, whatever. You could probably go up to 60, 70, or even 80 grams of carbs, but that is an exception. You know what, Karen? I think it's, I don't know if I asked this question or not. Let's see here. I think I already asked that question. Yeah. Okay, so never mind.
Okay, well, let me ask you this. Does
Yeah.
keto increase estrogen?
No. It will not increase your estrogen. It doesn't, it won't decrease it either. It will enhance your hormone effectiveness. But now, if you're eating foods with estrogen, that could spike it. Like if you're doing a lot of dairy, that's commercial dairy, that could be a problem.
Okay. And again, the weekly question,
What?
can you do keto and breastfeed?
Yes, but not exactly the same time. You know, do keto and then wait and then do breastfeeding. Like, because it's gonna be hard to do, unless, oh, I guess you could. You got two hands there, one to hold the baby and then, you want to do keto if you're breastfeeding. You want to do keto if you're pregnant. You just don't want to do intermittent fasting. Okay?
Norman has dark circle only under one eye, his left eye.
Did someone punch him?
I was going to say that, but I thought, no, he has a real question.
Well, the only thing I would say to that is that if the right side's related to the liver, the left side's related to the heart. So there could be a connection there. I have no idea. You stumped me. Okay. With the keto aminos, oh yeah, what is the equivalency on the back of the bottle? Is that equivalent to grams of protein or grams of food? It's grams of, it's grams of protein in food on the back of the bottle. But if you go to the website, we give examples of the different foods, but the actual protein in the food, not the weight of the food. Okay, ignore that.
Okay, this person has asked this question about 7 times.
Yeah, what's
so
that?
Your opinion, is the blood type diet valid? I mean, that's it's not what we do or talk about.
It sounds valid. It sounds like there's a technology, but if you look in the back of the book and look at the research, it just doesn't really go anywhere. I couldn't find any hardcore data. So all 4 diets are fairly kind of combinations of healthy food. So honestly, I think you're gonna feel better on any one that you do. And you may feel better with more protein or less protein or taking this protein, but honestly, I've not found this like, wow,
100% across the board.
Yeah.
If you're this type, you eat this and you always feel better.
Yeah.
Just haven't seen it.
I have not seen it. I'm sorry.
But not saying don't try it.
You know, you try it and see if it helps you.
Yeah, you're the best researcher. Is it working for you?
All I can tell you is that the eating plan that we put people on, I have a lot of experience with that, and it gets great results, okay? If you do it. Whoopsie daisy, let's go cancel.
Oops.
Okay.
I meant to block that.
Okay, so Brian from Minnesota lost 70 pounds on keto. Wow,
Brian,
congratulations,
awesome.
Brian. Is cheese bad for you? I consume cheese on a regular basis because I'm from Wisconsin.
This is from Wisconsin.
But here's the thing, if you have any prostate issues, if you have any reactions to eating cheese, then you might want to cut it down because there are hormonal things that could influence you because it's from milk, which actually is meant for a cow. But there's some good quality things in cheese, especially like vitamin K2. So I would test it out and see if you feel better with it. But here's the key, make sure your cheese is from grass-fed cows and organic, and preferably from Europe because it's just a higher quality. Is the cheese from Europe taste better? France?
Yes.
Italy?
Yes.
Oh my gosh.
Well, all the food over there, these guys, they don't put hormones in the meat or the milk. They don't spray stuff on their food. They use sulfur and phosphorus if it's needed.
Yeah, that's right.
It's just, they're not doing all this stuff to their food. It's actually illegal.
Yeah.
So you just feel better when you eat it, regardless of what you're eating. And it doesn't tear the body apart. It doesn't start to make the body sick. It doesn't give the body a hard time doing its normal duties, and
right.
People feel better.
Someone asked about the antibody test with Hashimoto's. What do you do for that if it shows positive? You want to take a very powerful antioxidant, which is selenium. Selenium. Okay, so I have a video on that. The other question that someone asked is, I have a gallstone 2.7 centimeters. Will the gallbladder formula dissolve it? I don't know, but I do know that the bile salts help to dissolve or prevent the formation of stones.
What happened?
So, oh, what happened here?
There
Okay,
we
good,
go.
popped back. So yeah, so I think it can help you, but you're just gonna have to try and see what happens. Sonia from San Antonio, Texas had a question about skin and fingertips getting dry on keto. That does not mean more water. That means you need essential fatty acids. You need more fat. So either you're not having enough essential fatty acids, and I'm talking about like the fish oils or cod liver oil, or it means that you're not producing enough bile to absorb that. So it could be more liver, gallbladder, or you need more of the fat. I have done a video on that as well. For those of you that are new on this channel, just realize we have a video on every single question that you're asking. Lemon juice for stones, especially kidney stones more than anything, it's really good. If you were to consume a cup of lemon juice per day, that would actually greatly help you because the citrates prevent the oxalates. And also drinking enough water, like about 2 to 3 liters of water per day, with the lemon juice will actually help to prevent the supersaturation that occurs with kidney stones. So you may want to check that. What do we got, Karen? Any other questions here? Does anyone have any questions?
Someone's wondering where you buy your cheese.
I go to Trader Joe's, and that's where I get the cheese because it's they have some European cheese at a very good, reasonable price.
There you go. Some of these fly by so fast.
Yeah.
Okay, we already did the bone broth.
You can't do bone broth anytime. You only want to do it with a meal if you're consuming it. because-
Okay, this person's been, it's either the same question or, keto for a number of months has diarrhea all the time.
Yeah, I think that's the fiber. You might want to cut down your fiber. You could have either an imbalance with good bacteria that's preventing you from digesting the fiber, or you could have SIBO. It could be a couple other reasons, but I would cut down the fiber or change the different types of vegetables you're consuming, and that should handle the diarrhea. But if you wanted to quickly stop diarrhea, blend plain kefir with blackberries. Blend it up and consume that. That will actually stop diarrhea. Okay? Dennis, or Denise, or Dennis? What's your-
Where are we?
Denise, hi.
Dennis.
You had a question.
Hi,
I
Denise.
mix fiber with the weak. Yeah. Okay, so good question.
Go ahead.
Awesome. Hey, Denise, since no one can hear you, I just want to tell people what you said. Karen's going to tell people.
Oh, so she's been on keto and she's doing great. She got on it for inflammation and it's handled that. She has no inflammation in 3 major joints. It's going really good.
That's awesome. And also, she just wanted a question. Can I mix the fiber in your wheatgrass, fiber in the wheatgrass?
With your wheatgrass.
Sure, yeah, no problem at all. Not an issue. Because the wheatgrass juice that I have it doesn't have fiber in it. It's the juice part without too many carbs. Good question. All right, what do we have?
What if you had unwanted body hair?
Female or?
It doesn't say. Not sure.
That's usually
just general.
Yeah, that's too much androgen. So that's usually, it's usually you're probably talking about female. That means your insulin is too high. And by the way, guys, if you're just starting out and you're going to your doctor, demand that they do a fasting insulin test, because all the problems from diabetes start with high insulin, not blood sugar. You have normal blood sugars for 10 to 20 years, and then all of a sudden you get diabetes. But all this starts with high insulin, but they never test it. And a lot of times when you get diabetes type 2, they give you insulin. So it's the problem of too much insulin. That's the real disease, because that's what creates the problems with the eye, the nerve, the heart and your brain, okay? So get the fasting insulin test, and then you'll know for sure. Sweating excessively.
Excessively,
Yes,
not successfully.
right, excessively.
Successful
That
sweat.
means your
Sweating a lot.
adrenals are overactive, so I would take, for that, I would take more B1, and also I would follow my videos. Oh, that's much better.
That's better.
Follow my videos on supporting adrenal burnout, adrenal fatigue, because I have probably over 100. All right.
I'm still hungry on keto. Could this be an indication of a health problem? I'm already eating over 80% healthy fats and still not satisfied.
Yeah, what you want to do, you get satisfied with nutrients, okay? So you want to do fat and also nutrient-dense foods, like that huge bowl of, what do they call that? Salad. And all those vegetables, in addition to enhancing your diet with nutrients, will start to speed things up. But either you have insulin resistance, which is still being a problem, which takes some time, or you need to do more nutrient-dense foods to really solve this problem. Shaky hands.
Could be a number of things.
That's usually low dopamine. I tell you what can actually help you with that. I should do a video on this, tremors. MCT oil. MCT oil. Try some. You'll see. You'll like that. Okay. Bonnie from Reno had a question. Blood tests before and after keto. You want to know what blood test to do, Bonnie?
Bonnie?
Okay, Bonnie, I'm going to put you on hold. So Bonnie wants to know what blood tests before and after keto. What's some important blood tests? Well, you could do a general blood test to look at your cholesterol and your triglycerides and your glucose and all that, but I would definitely get a test, if your doctor will do it. It's called HOMA-IR. And HOMA-IR is a test to pick up insulin resistance. And in that test, they will do a fasting insulin test, and they'll be able to look at it. The problem is this, Karen. There is no agreement on what is normal, a normal fasting insulin test. So some doctors say it's 20, some doctors say it's 8.
What do you say?
It's 5. It's going to be 5, because if you look at the studies, every degree over 5 or every number over 5, there seems to be more risk factors for cardiovascular. So you want to have 5 or less. That would be a good number. Again, Bonnie, that's just my opinion, okay? An opinion of one person. Good question.
Pretty important person.
I would think so. All right, let's see.
So what's the difference between MCT oil and coconut oil?
Good question. So MCT oil is medium chain triglycerides, and that's a type of fat that is actually in coconut oil. So MCT oil is extracting that fat specifically out of the coconut, leaving the other stuff. So you have a more concentrated version. And the advantages and benefits of MCT oil, I have actually 15. I won't
Listed right here.
I won't go through them, but I will say this. You guys are very intuitive. You're picking up all my videos before I'm doing them. I don't know how you're doing that, but you guys are very in tune. The problem with MCT oil is that it's a refined product, but it's actually good to help feed the brain and the heart in the beginning of doing keto. But the benefits are that it'll actually feed the brain and the heart the fuel that it needs. So there's a lot of benefits, but that's really the difference. If you just take coconut oil, you'll get MCT oil, but not in the concentrated amounts. Okay? So while Karen's looking up another question, let's go to Rebecca from Haymarket, Virginia. Do you know where the Haymarket is?
Yeah.
So what's the best indicators of liver health? I would say some of the best indicators of liver health would be looking down at your stomach. If you have something bulging out in your stomach, then we know there's a problem with the liver, and that's called a fatty liver. Also, your energy level through the day, because if you have a liver problem, you get chronically fatigued. Also, your joints. Are your joints free of pain? Stiff, painful joints would indicate liver problems and just inflammation in general. Also the eyes. Look at the whites of the eyes. And you have some, your eyes are white. So if they're yellow, that's a liver problem. If you have these, the skin, if you have these liver spots and these little red dots, that's a liver problem. So you look at the skin, the eyes, if they're bloodshot, that's a liver problem. Breath, if they have chronic halitosis, then it's a liver problem. So those are some of the indications. Thanks, Rebecca, you just gave me another idea for another video. I was looking for one.
Note it down.
Note to self. Then we have Anisha from Pennsylvania. Had a question.
Where in Pennsylvania? Find out.
Where do you live in Pennsylvania?
Harrisburg. Okay.
Harrisburg. Well, Karen is from
Allentown.
Allentown. There's a song about that.
It's nothing like the song.
Okay. So had an injection to treat retinal blocking in my left eye. Okay. So I'm guessing what can you do about it, right? That's what you're asking, like how to deal with that right now? Okay. There's a really, really, really good product that you can research on the internet. It's called Oculotrophin PMG. It's from Standard Process, Oculotrophin PMG. And then what you can do is you can take one before bed, and it seems to really help the eye. But it's damage to the eye. The other two things that you should do is get on healthy keto and intermittent fasting, because high insulin and high blood sugars prevent the healing of the eye and also create a lot of eye problems, especially for the retina. But there's one last thing you can do, Karen. You can take benfotiamine, which improves nerve tissue, and guess what the retina is? It's part of your brain sticking out of your eye. So your retina is basically nerve tissue, and you can improve that by benfotiamine, which is a fat-soluble B vitamin, B1, which is really good for the retina. But don't forget the Oculotrophin PMG. Get that product. It's really awesome. Let's answer 2 more questions.
Okay, sure. Let me read that. Get back here. Get back here. Do you have any suggestions for someone dealing with excessive saliva in the morning? It doesn't seem to go away until eating.
Wow. Well, the saliva is produced by the different glands, the parotid glands, and honestly, I would look at making sure you're doing the basic program correct, because it could be any number of things. Like, are you taking enough zinc, for example? Zinc can actually control the different exocrine glands. That's what you're dealing with, the function of that. And like, are you, for example, when you're doing keto, one of the best foods you can consume is shellfish on keto, because it gives you the trace minerals. So I would look at the basics and try to implement that, and I think that can help you greatly. All right, Karen, what do we got here?
It's after 12.
One more question.
Okay,
Because
one
we
more
started
question.
late.
That's true. Okay. Ketone power, we know about that. Too much manganese can do what in our body?
You know what? You're gonna have to look that up. I don't know. What about taking ketone powder? Now you're talking about something called ketone salts. There's 2 types of it's called exogenous ketones. One are the salts, and the other ones are what's called esters, which are very expensive, and that's mainly for people that are exercising and also people that have Alzheimer's. What I would do if I were you is I would take that maybe while you're exercising, and it might help you. I think it's not needed for most people. I don't think you need it, but it's something that some people do. But make sure you don't ignore doing keto healthily, because that's the whole purpose of this thing, is to get healthy, not just to get you in ketosis. Ketosis is one part of this program, but you got nutrients, you have the purpose of reducing insulin, all the benefits from that. So that's what I would do. Anyway, guys, I really, sorry about the situation with this
Streaming.
Streaming. I am going to try to find out what's going on and try to handle this next week. I appreciate all your patience and your tolerance for this problem.
And your patience.
And your patience being in a waiting room. Anyway, have a great weekend, and we will talk to you next week. And stay tuned for some really cool videos that we'll be releasing in the upcoming days. Have a good one, guys.
There's your big